There are so many remote places on the planet where people still can't access even the most basic health products. Sub-Saharan Africa is generally considered to be some of the lower income countries on the planet. Their healthcare systems don't always have the resources and the infrastructure required to get healthcare and medical products like vaccines, treatments, blood samples to these remote areas. My research is 3 in-depth case study analyses of medical delivery drone systems in Rwanda, Madagascar, and the Democratic Republic of the Congo. I'm hoping to get a very broad understanding of the facilitators, barriers, and processes that go into implementing drone technology and then scaling it up to a level where it's most impactful. When we're talking about global health inequities, it's about access to timely and quality health care. A drone delivering a bag of blood could be the difference between life and death. I think that impact kind of speaks for itself, right? The evidence shows great improvements in terms of less product wastage, higher child immunization rates, lower maternal mortality. When I hear stories of people being saved by drones, it just really fuels the fire in me. It gives me a reason to keep going because I know that this work will impact people's lives.